Hello, my name is Monica Laszkowska, and I'm a gastroenterologist at Memorial Sloan Kettering Cancer Center.
My name is Arnold Markowitz, and I'm also a gastroenterologist at Memorial Sloan Kettering Cancer Center. We are excited to share some insights into our recent study titled Factors Associated with Detection of Hereditary Diffuse Gastric Cancer on Endoscopy in Individuals with Germline CDH1 Mutations. It is well established that individuals with germline pathogenic CDH1 variants have a high risk of hereditary diffuse gastric cancer, with a lifetime risk as high as 70% in some individuals. A major diagnostic challenge in this population is that most individuals with this mutation have quiescent foci of gastric signet ring cell carcinoma hidden below the surface of the epithelium from a very young age. These foci may be as small as a cluster of just a few cells and are notoriously difficult to detect on endoscopy. More importantly, we don't know if and when these foci may turn into more invasive or metastatic tumors. Because of this, current risk reduction guidelines advise that individuals with these CDH1 variants undergo risk-reducing total gastrectomy in early adulthood. However, the decisions to undergo such procedures are highly complex and individualized, and for a variety of reasons, patients may elect to delay or opt against gastrectomy. For these patients, guidelines suggest annual surveillance endoscopy, which should be done at expert centers.
Dedicated endoscopic protocols, such as the Cambridge protocol, which entails targeted biopsies as well as 30 random biopsies throughout the stomach, have improved endoscopic detection, but the sensitivity of endoscopy in detecting signet ring cells in these patients remains low. And so in this study, we aim to identify endoscopic findings and biopsy practices that may be associated with increased detection of signet ring cells. Given the experience at our center with endoscopic evaluation of these patients in the periods before and after implementation of the Cambridge protocol, we have the opportunity to assess a spectrum of biopsy practices. We identified 98 patients with a germline CDH1 variant undergoing at least one endoscopy at our center between January 2006 and March of 2022, with a total of 178 EGDs during this period. We would like to highlight a few key observations we made which we think reinforce important concepts in improving the efficacy of endoscopy in these patients. First, biopsies of pale mucosal areas were significantly associated with increased detection of signet ring cell foci. These pale areas may reflect early stages of visible infiltration and require special attention with use of tools like NBI to optimize visualization. While pale mucosal areas appear to have enhanced specificity for identification of these foci, they were only seen in a relatively small subset of individuals in our cohort and can't be relied on as a sole diagnostic indicator. Our findings are in line with another large recent study by Lee et al. In Lancet Oncology this year, which similarly found high specificity but low sensitivity for pale areas, and also defined a panel of endoscopic criteria for enhancing detection in pale areas. Nonetheless, this highlights the importance of combining random biopsies with targeted samples to optimize diagnostic yield.
Another important observation we made was that a higher number of biopsies taken on EGD was associated with increased detection of signet ring cells, with detection reaching as high as 43% when more than 40 biopsies were taken. Our study is the first to compare a spectrum of biopsy numbers on a granular level, and our findings go along with other studies, such as those of Curtin et al. In the Journal of Gastroenterology in 2021 that showed increased detection with 88 random biopsies taken as compared to 30 biopsies. This lends further support to the importance of taking adequate random biopsies. Moreover, we showed that the detection of signet ring cells on preoperative endoscopy was more likely when subsequent gastrectomy specimens showed a larger number of foci of signet ring cells, and that foci were predominantly identified in the proximal stomach both on EGD and gastrectomy. These findings align with the International Gastric Cancer Linkage Consortium's updated 2020 guidelines, which prioritize biopsies in the proximal stomach.
Finally, we showed that outcomes of short-term endoscopic surveillance in 32 patients were favorable, with no patient progressing to advanced gastric cancer during the study period. Of course, it's important to say the follow-up period in our study was limited, with a median of 17.9 months. Nonetheless, two other recent studies by Lee et al. And Asif et al. In Lancet Oncology this year also suggest that short-term endoscopic follow-up may be feasible. and this may provide patients with additional time to adequately prepare and plan for further management decisions. While our study had several strengths, we also acknowledged several limitations, including that it's retrospective, has an observational design, and reflects experience from a single center, which may limit generalizability. Endoscopic protocols were also not standardized at our institution throughout the study period, and certain aspects such as the types of lesions targeted for biopsy and the number of biopsies were at the discretion of the expert endoscopist. Additional studies are needed to assess the remaining questions, such as the pathophysiology of the development of pale areas, the number of biopsies needed for adequate endoscopic assessment, and clinical follow-up to validate what role, if any, more long-term endoscopic surveillance may play in the management of CDH1 patients, as well as those with other variants, such as the CTNNA1 gene, which also have a predisposition to hereditary diffuse gastric cancer.
To summarize, we believe that our study suggests that incorporation of targeted biopsies of gastric pale mucosal areas, focusing random biopsies in the proximal stomach, and increasing the number of biopsies taken may improve endoscopic yield. And our findings emphasize the critical need for future studies to continue to refine endoscopic surveillance protocols to improve signet ring cell detection in this high-risk population. Thanks for taking an interest in our study, and we invite you to read the manuscript to learn more about our findings.